A very good morning to everyone joining us today. It is truly a privilege to welcome each and every one of you. Sleep, such a simple word, yet such a profound part of our existence. Every night, as the world slows down, sleep embraces us quietly, healing, restoring, and rebuilding what the day has worn down. And yet, despite spending almost one third of our lives sleeping, how often we take it for granted. Today, sleep disorders are silently affecting millions of lives, disrupting health, draining vitality, and burdening societies. Understanding sleep, therefore, is not just a medical need today, it has also become a human need.
It is with the profound realization that the Hind's Educational Initiative Program proudly presents the certificate course in sleep medicine, an initiative dedicated to empowering sleep medicine education and inspiring better healthcare for a better rested world.
And today, even though we are joining from different cities, different homes, and different corners of the world, technology has brought us together into one vibrant learning family. In spirit, in purpose, and in vision, we are closer than ever. It fills us with deep joy and gratitude to welcome our esteemed faculty members, our honored guests, our enthusiastic participants, and our respected patrons. Your presence here is not just participation, it is a shared belief that every individual deserves not just life, but a life full of rest, healing, and hope. Thank you for being with us. Together, let's awaken the world to the power of better sleep.
Along with the online presence, we are truly blessed by the gracious presence of some of the most distinguished stalwarts. It is with the folded hands and deep respect that I welcome Dr. D.P. Mishra sir, our CMS and esteemed member. First, I would like to warmly invite Dr. Shweta Kanchanman, our organizing secretary for the program, to kindly come forward and felicitate Dr. D.P. Mishra sir.
Now I would like to invite Dr. G.K. Tripathi sir, the senior most member of Hind and Shekhar family, a guiding light of our institute. I request Ms. Meeta Sharma, a very dynamic and dedicated member of the CCM organizing team, to kindly come forward and felicitate Dr. G.K. Tripathi sir.
CCSM.
And now, Dr. Shweta Kanchanman, our organizing secretary of the program. Next, I invite Mr. Bharat Bhushan, a very diligent and hard-working member of the CCSM organizing committee, to please come forward and felicitate Dr. Shweta Kanchanman.
And now our scientific secretary, most dynamic and versatile, Dr. Nandita Prabhat ma'am. And I would like to call upon a very cheerful and vibrant member of the CCSM family, Dr. Alka Saxena, to kindly felicitate Dr. Nandita Prabhat ma'am.
We are truly honored by your presence here today, and we extend our heartfelt gratitude towards each one of you.
Before we formally commence the proceedings, let us invoke the blessings of Goddess of Knowledge, Wisdom and Light, Mata Saraswati. I request everyone to please rise and join in the Saraswati Vandana. Simultaneously, I humbly invite the esteemed dignitaries present on the dais to kindly participate in the lamp lighting ceremony.
श्वेत
शेष जाड्या पहा.
Thank you everyone for joining in this auspicious beginning. Now, with utmost respect, I invite Dr. A.K. Sachan sir to kindly inaugurate the certificate course in sleep medicine and formally declare the program open.
नमस्कार. आज की इस सुबह में आप सभी लोगों का बहुत बहुत स्वागत है. आई एम वेरी हैप्पी टू see this occasion when a detailed discussion on sleep medicine is going to happen. मैं अपनी तरफ से सभी फैकल्टी मेंबर्स और डेलीगेट्स का हृदय से स्वागत करता हूँ. स्लीप मेडिसिन बहुत दिनों से इग्नोर्ड है और इसके बारे में बहुत कम जानकारी थी. जब जानकारी आई भी तो उसको कॉमन प्रैक्टिस में इग्नोर किया गया. स्लीप मेडिसिन जितनी समझी जाती है उससे उसका कहीं ज़्यादा महत्व है. ज़्यादातर हम स्लीप मेडिसिन वहाँ पर इस पर थॉरली देखने की कोशिश करते हैं, जैसे स्लीप एपनिया या वेरियस ऑब्स्ट्रक्टिव रेस्पिरेटरी डिजीज, लेकिन इसका इससे कहीं ज़्यादा महत्व है. हम सभी लोग जानते हैं कि हमारे ब्रेन में हाइपोथैलेमस में के नीचे एक सेंटर है जो कि बायोलॉजिकल क्लॉक की तरह काम करता है. और हम जो भी शरीर के अंदर जो जितनी घटनाएं होती हैं वो सारी की सारी उसी बायोलॉजिकल क्लॉक के कारण से होती हैं. हमारे जो हार्मोन्स रिलीज होते हैं, न्यूरोट्रांसमीटर्स रिलीज होते हैं, वो सब एक स्पेसिफिक पैटर्न में रिलीज होते हैं. और यदि वो हम अपनी दिनचर्या को नियमित नहीं रखते हैं तो वो सब एबनॉर्मल रिलीज होते हैं. तो मैं आज इस ओकेजन पर ये एक्सप्लेन करना चाहूँगा कि हम सभी लोगों को स्लीप मेडिसिन में जब हम बात करते हैं तो इसको बहुत ही ब्रॉडर वे में लेके जाएं. वो जो डिजीजेज हैं उस पर अकेले फोकस न करें कि ये जो लिमिटेड डिजीज स्लीप डिसऑर्डर्स हैं खाली उस पर फोकस करें. स्लीप सबसे महत्वपूर्ण एक हमारा आयाम है हमारे जीवन का. हम पूरे जीवन में लगभग 33% समय सोने में खर्च करते हैं और उसकी गुणवत्ता पर कोई ध्यान नहीं देते हैं कि स्लीप हमारी किस लेवल की है, किस तरीके की है. और हमने जो बहुत सारी अन्य चीज़ें अडॉप्ट कर ली हैं मॉडर्न लाइफ स्टाइल में, उन सब ने हमको बहुत ज़्यादा परेशान किया है, बीमार किया है. तो मैं उन आयामों में जिन पर इस परिचर्चा में पूरे इस दौरान डिस्कशन होंगे, मैं उसके बियॉन्ड आपको ले जाना चाहता हूँ. वो तो आप लोग इस ड्यूरिंग द कोर्स ऑफ दिस सेशन यू विल लिसन एंड लर्न. लेकिन स्लीप कब होनी चाहिए, कितनी होनी चाहिए, इस पर विशेष चर्चा होनी चाहिए. कितने बजे सोना चाहिए, कितने बजे जगना चाहिए, इस पर चर्चा होनी चाहिए. किस लेवल की हमारी स्लीप पैटर्न हो, कौन कौन सी लेवल पर हमारी स्लीप आए. क्योंकि जिस तरीके की हम दिनचर्या है कि रात के सोते समय तक हम ब्लू स्क्रीन अपने सामने रखते हैं, चाहे मोबाइल की हो चाहे टीवी की हो, तो हमारे ब्रेन में बहुत एबनॉर्मल उसका रिस्पॉन्स आता है और उसकी वजह से हमारी स्लीप बहुत शैलो रहती है. जो नॉर्मल स्लीप पैटर्न है हम सब जानते हैं कि बीटा वेव होती है जब हम जगे होते हैं. जब हम सोने का प्रयास कर रहे हैं तो अल्फा होता है, फिर थीटा होता है, फिर डेल्टा होता है, फिर अल्टीमेटली गामा वेव्स आती हैं. हम लोगों की दिनचर्या के कारण हमारी स्लीप बहुत ही ज़्यादा शैलो रहती है और अक्सर बीटा, अल्फा और थीटा तक जाती है, डेल्टा तक बहुत कम जाती है. डेल्टा वेव की स्लीप है जो हमको कंप्लीट रिलैक्सेशन देती है. उसके बाद उसके साथ ही साथ इस रिलैक्सेशन का जो एडवांटेज है जो हमारी बॉडी उठाती है कि जितना भी शरीर के अंदर रिपेयर एंड मेंटेनेंस होता है, ग्रोथ होता है, वो सारा का सारा इसी दौरान होता है. सारे हार्मोन्स इसी दौरान रिलीज होते हैं सुबह 4 बजे से लेकर के 8 बजे तक के दौरान. और वो सारे यदि हम अपने स्लीप पैटर्न को ठीक नहीं रखते हैं तो वो एबनॉर्मल रिलीज होते हैं और बहुत सारी बीमारियों को जन्म देते हैं. तो इसलिए हमको इस पैटर्न पे जिसको आजकल हम लोग क्रोनो मेडिसिन भी के नाम से जानते हैं। और क्रोनो मेडिसिन में फार्माको क्रोनो मेडिसिन आ गई है। सब तरीके से हर दवा में, हर बीमारी में क्रोनो मेडिसिन का उपयोग हो रहा है। और ये बिल्कुल जेन्युइन है, ये वास्तविक है, समझ में देर हुई। हर्बर्ट फ्रेंच ने 1958 में इस क्रोनो मेडिसिन का नॉमेनक्लेचर किया। लेकिन ये बहुत आश्चर्य की बात है कि हम भी उसी को नाम दे, हम भी उसी तरीके से उसको रिकॉग्नाइज करते हैं कि ये क्रोनो मेडिसिन उन्होंने नाम दिया। और ये लोगों को उसके बाद इसकी जानकारी हुई और उसके बाद उनको नोबेल अवार्ड मिला। ये सब सही है, लेकिन क्रोनो मेडिसिन और स्लीप मेडिसिन ये हमारे सनातन धर्म में आदिकाल से चला आ रहा है। हमारे सब ऋषि मुनि इसी पैटर्न में सोते थे, जगते थे। तो हमको भी अपनी दिनचर्या में ये परिवर्तन लाना होगा कि हमको सूर्यास्त के 2.5 घंटे बाद हमको सो जाना चाहिए, लगभग 9:30-10 बजे। और जगने का टाइम सूर्योदय के 2.5 घंटे पहले जगना चाहिए। ये एक स्टैंडर्ड प्रोटोकॉल है। इसका अगर हम उपयोग करें तो हम बहुत सारी बीमारियों से मुक्ति पा सकते हैं। उसके अलावा जो एबनॉर्मल हमारे थॉट्स आते हैं, उनकी वजह से हमारी स्लीप बहुत डिस्टर्ब होती है। इसलिए सोने के 1 घंटे पहले हमको पूर्णतः अपने आप को डिस्कनेक्ट कर लेना चाहिए। और प्रेफरेबली ये है कि हम कोई कर्णप्रिय म्यूजिक सुने या कोई ऐसा काम करें जिसमें मन के अंदर शांति पैदा हो। सबसे अच्छा तो है कि वो आप रात में सोने पहले अगर ध्यान की प्रक्रिया को अपनाएं तो पूरी रात आप ध्यान करेंगे। और आपको सुनकर के एक और बहुत आश्चर्यजनक घटना मैं बता सकता हूँ कि हमारी जो रिकॉर्डिंग है माइंड की, वो रिकॉर्डिंग में जो कॉन्शियस माइंड और सबकॉन्शियस माइंड की जो बैरियर है, जो बहुत स्ट्रांगली बना हुआ है, और कॉन्शियस माइंड जो भी कुछ सबकॉन्शियस माइंड को कहता है वो नहीं सुनता है, वो भी सुबह जब डेल्टा वेव की स्लीप होती है, जिस समय भी डेल्टा वेव की स्लीप होती है उस समय वो बैरियर खत्म हो जाता है। तो यदि रात सोने के पहले यदि आपने अपने आप को कुछ ऐसे निर्देश दिए हैं, कोई डायरेक्शन दिए हैं कि मैं ये करना चाहता हूँ, मैं ये सोचना चाहता हूँ, ये बनना चाहता हूँ, अगर आपने वो निर्देश दे करके अपने मन को सुलाया है तो वो निर्देश सबकॉन्शियस माइंड में चला जाते हैं और सबकॉन्शियस माइंड उस संकल्पों को पूरा करने में लग जाता है। ये बहुत ही अनूठी विद्या है, लेकिन हम लोग इस पर ध्यान नहीं देते हैं। हम रात के 12-1 बजे तक शोर शराबे में रहते हैं, उल्टा सीधा करते रहते हैं। सोने की प्रक्रिया करो, खाने की प्रक्रिया करो। और सामने इसमें बहुत बड़ा महत्व है भोजन का। भोजन सोने के 2.5 घंटे पहले हो जाना चाहिए। जिस समय हम सोएं उस समय हमारा स्टमक बिल्कुल खाली होना चाहिए। जो गैस्ट्रिक एम्प्टी टाइम 2.5 घंटे है और 2.5 घंटे के बाद पेट पूरा, स्टमक पूरा खाली हो जाता है। आपको कोई रिकैचिनेशन नहीं होगा, कोई फ्लैटुलेंस नहीं होगी, कोई एसिड डिजीज नहीं होगी और आप सामान्य शांत स्लीप पाएंगे। तो मुझे बड़ी खुशी है कि डॉक्टर श्वेता कंचन ने इस तरीके की एक कार्यशाला का आयोजन किया है। मैं समझता हूँ इसमें बहुत सारे जो हमारे विशेषज्ञ पूरे देश से जुड़े हुए हैं, वो सब हमारे डेलीगेट्स की इस जिज्ञासा को स्लीप लैब से संबंधित शांत करेंगे। आप सभी को इस वर्कशॉप के लिए बहुत बहुत शुभकामनाएं। थैंक यू, नमस्कार।
Thank you so much, sir. Now it is my distinct privilege to invite Dr. Anuj Maheshwari, sir, our organizing chairman, who will be sharing his words of wisdom with us via the online medium, dividing any physical barriers.
Hi friends, myself Dr. Anuj Maheshwari, myself Professor in Medicine at Hind Institute of Medical Sciences. Today I welcome you all in the inaugural session of certificate course in sleep medicine, which we are going to start on behest of Hind Institute of Medical Sciences. I welcome all specialty people for this wonderful course, which is actually an integrated approach of multidisciplinary and multi-speciality for sleep medicine. Whenever we talk about the insomnia, we find that it is increasing problem not only in India but also across the world. About 10 to 15% people are suffering with insomnia across the world. In India, 12.3 to 30% people are having the problem related to the insomnia, which may be considered as the sleep disorders of the various categories. And so you can that every third person is suffering with the disease related to the sleep. We can diagnose it well, we can treat it well if we are having a crystal clear idea about the sleep medicine. Just to make apprised of those methods and treatment options for treating sleep disorders, we have started this course, and I believe you all will be much benefited and become more wiser after going through this certificate course on sleep medicine. Thank you very much.
Thank you very much, sir, for those inspiring words. Now we would love to hear a few words from our respected dignitaries seated on the dais. I humbly request each of our distinguished guests to kindly share a one-line thought or blessing for this initiative. Firstly, starting with Dr. D.P. Vishwa, sir.
शेखर चिकित्सालय शेखर चिकित्सालय परिवार शेखर चिकित्सालय परिवार की तरफ से इस सर्टिफाइड कोर्स ऑफ स्लीप मेडिसिन में भारतवर्ष के विभिन्न स्थानों से पार्टिसिपेट कर रहे डेलीगेट्स का मैं हार्दिक स्वागत एवं अभिनंदन करता हूँ। स्लीप मेडिसिन मेडिकल फील्ड में एक नई ब्रांच है। स्लीप सबके लिए ज़रूरी होती है, लेकिन इसके बारे में अभी भी ना केवल जनरल पॉपुलेशन बल्कि डॉक्टर्स में भी अवेयरनेस की कमी है। आई मस्ट कॉन्ग्रेचुलेट डॉक्टर श्वेता कंचन, जिन्होंने यह बीड़ा उठाया है कि स्लीप मेडिसिन के लिए लोगों को जागरूक करने के लिए। इट इज़ वन ऑफ द वेरी इंपॉर्टेंट सब्जेक्ट which is related with so many comorbidities, and I hope this course will definitely give knowledge to broader aspect to these angles. डॉक्टर श्वेता कंचन हम लोगों से काफ़ी दिनों से जुड़ी हुई हैं और इनके अथक प्रयासों से ही यह संभव हो पाया है, क्योंकि इस ब्रांच को अभी भी हम लोग बहुत ज़्यादा सीरियसली नहीं लेते हैं, लेकिन आशा है कि इस आयोजन के बाद निश्चित रूप से हम इसे सीरियसली लेंगे। हिंद इंस्टीट्यूट ऑफ मेडिकल साइंसेज अपने स्थापना काल से ही इस तरह के आयोजनों से जुड़ा हुआ है और वैज्ञानिक क्षेत्र में मेडिकल लाइन से संबंधित जो भी विधाएं होती हैं उनके प्रमोशंस में आगे रहता है। वंस अगेन आई ऑल्सो कॉन्ग्रेचुलेट all of our delegates, or special thanks to our managing director and founder chairman of Hind Institute of Medical Sciences, Dr. A.K. Sachan sir, जिनके गाइडेंस में इस तरह के कार्यक्रमों में हम हमेशा आगे रहते हैं। थैंक यू वेरी मच।
Now we'll move on to Dr. G.K. Tripathi, sir.
Good morning, everybody. I welcome all the participants, those who are participating in this certificate course of the sleep medicine program. Actually, sleep medicine is one of the very new topic, and majority of the doctors, they do not know about the sleep medicine. And I think I appreciate Dr. Shweta Kanchan, who is doing the best possible into the awareness program of the sleep medicine. Practically speaking, sleep medicine is a multi-departmental department which covers almost your neuropsychiatry, it covers the pulmonary medicine, it covers the even pediatrics department and the neurology department and medicine department also. There are 3 points related to the sleep medicine. One of the important thing which is very common is insomnia. Everybody knows about the insomnia. And second thing is sleep apnea. Third point is restless leg syndrome. So these are the 3 points. Insomnia is concerned with the neuropsychiatry department. Sleep medicine is then apnea. Sleep apnea is related with the pulmonary medicine department. And restless leg syndrome is a department concerned with the neurology and medicine, both of it. So this is a multi-departmental department of the sleep medicine. You know that in medical science, day by day, new research is going on, and everybody wants to learn everything. I am having experience of about 49 years of working in the medical field after completing my EMD. But the daily new things are coming. We have to read everything and we have to follow everything. We have to study the newer things. So this is the importance of the medicine. And I think in future, if the public, if the doctors, those who are involved in this program, certificate course of the sleep medicine program, they will learn about the different topics also. They will learn about the sleep medicine, what is the sleep medicine, how we can aware everybody. In this point of view, I want to say that majority of the diseases nowadays, non-communicable problem, those which are becoming nowadays. For example, if you take the example of the hypertension, you take the example of the diabetes, take the example of dyslipidemia, obesity, insomnia, and non-alcoholic fatty liver disease, which is now called as metabolic associated fatty liver disease. These things are very common. These things are known as the metabolic syndrome disorders. And for this, sleep is also important. Lifestyle modification becomes the first line of treatment, and we say that you should be having a proper diet, you should be having proper exercise, you should have the proper sleep and have a tension-free life. These are the 4 points related to the metabolic disorders and lifestyle modification changes which are concerned. I think Dr. Sweta Kanchan, who is doing very well into the Hind Institute of Medical Sciences, and due to her only effort, we have come to know about the sleep medicine. I have attended 2 to 3 programs related with the sleep medicine, and I think all the participants, those who are participating in this program throughout the country, so I welcome all of them and best wishes for everybody, and I think everybody will be benefited from this program. I again thank Dr. Sweta Kanchan. Thank you very much.
Thank you so much.
Now I would like to invite Dr. Nanita Pramat ma'am for a few words.
A very good morning to all of you. I extend a warm welcome to all the delegates and all the course training faculty involved in this program. It is a very proud moment for our HIMSS group and Shekhar group that we are organizing such a big conference at such a big platform, national platform. Shweta madam has very beautifully designed this program. It involves all the aspects of sleep medicine, including respiratory medicine, neurology, psychiatry. All the aspects have been involved in this program. So I am sure all the delegates will surely benefit from this program. I look forward to being a part of this program, and I am very thankful to Shweta ma'am for involving me in this program. Thank you.
Thank you all for those truly motivating words. Now I request our organizing secretary, Dr. Sweta Kanchan ma'am, to kindly come forward and give us an introduction to the certificate course in sleep medicine, CCSM.
So, a very good morning to everyone. It is indeed an auspicious occasion for all of us as we commence today with the inaugural program of CCSM, that is the Certificate Course in Sleep Medicine, a program conducted under Hind Group Institute's initiatives in educational programs. So for each one of us who are here offline, and those dignitaries, our guests, our esteemed faculty members, our dear participants who have joined from all across India and are with us today online, I extend a hearty welcome and a thank you too, because this being a Sunday morning and you have taken out your valuable time to be with us on this inaugural session. So this program, this vision and this work, friends, was not possible but for the immense support and constant guidance that our team has been receiving from our senior mentors, from our chairman sir, Dr. A.K. Sachan sir, from our senior faculty, some of whom are present here, some off the dais, some on the dais, and others have joined online. So a very heartfelt thank you to all of them. This program has, it owes a big thanks to all our esteemed faculties who have joined from all across India and are with us today online. So thank you to all of you. Our academic team, a big thank you to the team for designing the program, Dr. Nandita, Dr. Parul, Dr. Abhishek, they all deserve a big thanks. Our hospitality team, our students, our technical team, Somnomedics for providing us the Zoom platform, and last, not the least, but the foremost, are dear participants who made this program possible, who made this program what it is, and made the program worth its while. So you are the ambassadors and leaders of future and the future of sleep medicine. Now, with thank you coming to an end, and it's heartfelt thank you from the entire organizing team, I would take the responsibility and a few minutes to introduce you to what this program would be all about. Could you give me a pointer? So, CCSM, or the Certificate Course in Sleep Medicine, its purpose and pedagogy. As we all know, that the prevalence of sleep disorders is very high and is getting higher by the day. Despite the high prevalence, the training opportunities are few and far between, sleep laboratories are equally few and far between, and there is an immense need for medical specialists, for medical professionals across medical disciplines to get training into sleep medicine, and so that they are able to benefit their patients, they are able to benefit their society, and they are able to improve sleep health by and large. So with that thought, this program was planned. This was a challenge because such programs, it needed a lot of brainstorming sessions by our academic team, and we came up with the design that crossing the geographical barriers, online medium is perhaps the best. How we could address this need for a large number of participants who really need an awareness and knowledge in the skill set of sleep medicine. So every small step matters. This is a small step that we have taken, and the step maybe could go a long way to enhance the skill set and knowledge for those it is intended, and maybe in the long run help the growth of sleep medicine and sleep technology in our country. So the objectives were kept as to impart a basic level knowledge in sleep medicine, sleep technology to the participants, to help them develop an understanding of the pathophysiology of sleep and circadian biology, to give them an understanding regarding the diagnosis and management of common sleep disorders and how they would be able to conduct the sleep diagnostic and therapeutic procedures. The methodology of teaching would be that there will be didactic lectures for which our esteemed experts have kindly given their consent. They'll be conducting these sessions from wherever they are. There will be online sessions. In between these sessions, our academic team will be providing a lot of educational material, lot of educational videos, and it will be a completely robust and dynamic academic session that goes on between these expert lectures on the topics that they specialize in. So of course we go with regular assessments to make it a more fruitful 6 months experience for you. So of course we all know there are almost 13 lakh doctors which are registered, and more than 10 lakh they keep adding. So it is very important that we prioritize sleep education because that will benefit each and every one of them, and this is a small step in that big journey, and thank you so much for being a part of this small step. So we once again thank you from the entire organizing team. All participants, we extend a warm welcome as you join us in the 6 months long journey, which I firmly believe will be fruitful to you, and you will be the ones emerging as leaders and ambassadors in sleep health. And now, I thank you all once again and call up the next session, which will be the inaugural session of the program. Thank you so much.
I can't see you. And of course, congratulations to Dr. A.K. Sachan for a regular academic activities going on in the Hind Institute of Medical Sciences. And this is a very special initiative by Dr. Shweta and her team, that having the online certificate course in the sleep medicine. Actually, sleep is very important for life, but it has been neglected as far as the social life is concerned and the public life is concerned. So I think this is a very wonderful initiative. So now I will share my PowerPoint. Yes. Share.
Sir, it is visible now.
Visible? Okay. Okay. So good morning, everyone. And congratulations again to the Sweta and her team. And of course, the Hind Institute of Medical Sciences. It's a big boss, Dr. A.K. Sachan. The implications and importance of sleep medicine, its relevance for medical professionals. So this is basically orientation and sensitization towards the sleep medicine. So I really congratulate to the all participants who are the part of this online certificate course for sleep medicine. And this is a very first lecture, I would say introductory lecture, so that this will usually sensitize you people towards the sleep medicine. Like whenever you go to the gym, so your gym trainer asks that first have the warm-up exercises. So this is a kind of warm-up for you people. Now, sleep has been from mythology to the modern medicine. You can see in the first picture, he's a Kumbhakaran, and it is said that he was sleeping for so many years and then he was awaking after so many years. So that was the mythology which we read in our books and stories. And we have landed into the modern sleep lab. So healthy sleep is vital for healthy life. Why? Because during the daytime, there is a trivial and sometimes major also injuries at the cellular and tissue level, soft tissue level, and the body repairs actually during the sleep time. So sleeping time is nothing, but it's like when your car is going to the garage for repairing. So every day your body is being repaired by this sleep process. That is the main purpose of the sleep, other than the, of course, taking the rest. So it's an unconscious state from which the person can be aroused, number one. It's a natural state of bodily rest observed throughout the animal kingdom. It's a common to all mammals and birds and also seen in many reptiles, amphibians, and even fish. In humans, other mammals, and a substantial majority of the animals such as fish, birds, ants, and fruit flies, regular sleep is essential for survival. Now, what is the importance of sleep? First, of course, for the cognitive function. If you don't sleep properly, your cognitive function will be impaired. So sleep aids in memory consolidation, learning, and maintaining the focus. And also important for the physical health, for the tissue repair, muscle growth, and energy restoration. Emotional well-being, this is also required for emotional well-being. It regulates mood and stress management. Disease prevention. So poor sleep is linked to the chronic conditions like cardiovascular disease, diabetes, and obesity. Now, this is the optimal sleep hours with the age. So whenever newborn baby, we require a lot of sleep. So newborn baby up to 18 hours is the normal sleep. 1 to 12 months, it's a 14 to 18 hours. 1 to 3 years is 12 to 15 hours. 3 to 5 years, 11 to 13 hours. 5 to 12 years, 9 to 11 hours. Adolescent, 9 to 10 hours. Adults, including elderly, they are 7 to 8 hours. And for pregnant women, again, it will require more. This is 8 plus hours. Now, what is the prevalence and importance of sleep disorder globally? Approximately 30 to 40% of the global population reports insomnia. Every third person in this universe having some or other kind of problem related to the sleep, and obviously most important is the insomnia. Obstructive sleep apnea, which is a multi-specialty disorder primarily dealt with by the pulmonologist, affects around 25% of men and 10% of women. So every fourth adult male, this percentage is for the adult population. So 25% of adult, you will write that, adult men and 10% of adult women. Restless syndrome, which is called RLS, this prevalence is 5 to 10% adults. You have seen probably in the night that sometimes a child or even a tired person, whenever sleeping, of course, in your bed with you, and the whole night he's you see hitting you by the legs. So this is called restless syndrome. Sleep disorders are undiagnosed with less than 20% seeking medical help. So 80% of the sleep disorder, they are not being consulted, they are remain undiagnosed and untreated. Now, if you see the global and India profile for the prevalence of sleep disorder, so 45% is the prevalence in the adult population as far as the 2024 data is concerned in a meta-analysis. And India also, data is around 35%. So it's a 45% versus 35%. So India is also having a significant number. This is all about the adult population, not the general population. So, and if you see the type of the prevalence, various kind of sleep disorder, then obstructive sleep apnea, this is the major chunk, 20% globally. And if you see in India, this is 50%. So out of the all sleep disorder, India is the capital of obstructive sleep apnea. If you see insomnia, then globally it is 30%, while in our country it is 34%. So almost equal. And if you see the restless syndrome, it is 10% globally. And here also it is 14.4% kind of prevalence in this country. So if you see, this is the again a latest meta-analysis, and this shows that insomnia is basically 25.7% in India, obstructive sleep apnea is 37.4%, restless syndrome is 10.6%, and circadian rhythm disorder is 2%. So I think we have to remember that obstructive sleep apnea is a very important condition for the all adult population. And lot of accident, lot of catastrophe events they happened in the history. And in India, the very important thing is the Bhopal gas strategy, which happened in 1984. And in that, around 4,000 people died because of this mishappening. Probably it was related to the obstructive sleep apnea. So sleep deprivation or because of the insomnia. So sleep deprivation among operators contributed to delayed reactions and mismanaged. I think everybody should mute because a lot of echo is there. So this highlights the critical role of alertness in the industrial safety. Now, the common sleep disorders, insomnia, we have already seen the profile of the insomnia, the prevalence of insomnia. The insomnia is nothing else but a difficult falling or staying asleep. Obstructive sleep apnea is the blockage of the airway, upper airway, causing breathing disruptions. Restless syndrome is uncontrollable urge to move legs. Narcolepsy is excessive daytime sleepiness and sudden sleep attacks. Circadian rhythm disorders are the disruption of internal body clock. Now, what are the social implications of sleep disorder? So it's not a medical disease only. It's not having medical implication, but it has social implications also. So workplace impact. Sleep disorder causes a 13% reduction in productivity globally. Accident, sleep deprivation increases the risk of road accident by 33%. If you analyze the road accident, then you will find that probably every third accident is because of the sleep related disorder. Mental health, 40% of insomnia patients suffer from anxiety and depression. So it's a very important psychiatric issue. Economic loss, sleep disorder contribute to 411 US dollar billion in economic losses annually throughout the globe. Family stress, 35% of partners of OSA patient and report sleep disorder. It's not common in India, but if you go in the Western world, then probably there is an increased chances of divorce if your sleeping partner is snoring and having obstructive sleep apnea. Academic decline. Students with poor sleep have a 20% drop in academic performance. Public health risk. Sleep apnea raises the risk of hypertension by 50%. And caregiver burnout, 40% of caregiverness for sleep disorder patient experience emotional stress. And this is not, you know that everybody knows there is clinical implication of sleep disorder. But in nutshell, if you see the heart diseases, the sleep disorder increases the risk of heart attacks by 48% and stroke by 45%. Hypertension, poor sleep raises the risk of developing high blood pressure by 50%. Diabetes, chronic sleep loss increases the risk of type 2 diabetes by 28 to 45%. Obesity, less than 5 hours of sleep raises obesity risk by 55%. So obesity causes sleep disturbances, and sleep disturbances promotes the obesity. So this is a vicious cycle. Depression, 70% of insomnia patients develop depression or anxiety. Immunity, sleep deprivation reduces immune response up to 30%. So I think the immunity is a very important factor which all the sleep specialists have to understand, that not simply the cardiovascular disorder is stroke, hypertension, diabetes, but your overall immunity will also get decreased. Neurodegeneration, poor sleep is linked to 1.5 times higher risk of Alzheimer's disease. Cancers, shift workers with disrupted sleep have a 30% higher risk of breast and colorectal cancer. Accident, sleep deprivation contributes 20% of road accident globally. So I think in India also, because OSA is rather more prevalent in our country, so we can say that every fifth or fourth patient in fifth or fourth accident in India may be contributed to the sleep deprivation. And we have done a study in our department that shows that roughly 20% of the truck drivers, they are having some sleep deprivation and obstructive sleep apnea. And that's why we recommend in that paper that all the driving license, when they are given, the 8 point, the questionnaire should be asked. That is called a stop bank before, and if it is more than 4, the score is more than 4, then person should be referred to the sleep specialist before giving them the driving license. And this paper I have sent with the request to ministry also, to the Nitin Gadkari ji minister also, that you should implement this rule. So this is I think the practice change publication from our department done a few years back. The workplace injury, sleep disorder increases occupational injury risk by 60%. Now, why this sleep epidemic throughout the world? Around 30, 40 years back, this was not the scenario, not in our country, but not in globally also. But here in this country, obesity has increased, stress has increased, and that's why sleep-related disorder has increased. But problem is lack of awareness about snoring and sleep disorder. And I'm really thankful to the Hind Institute of Medical Sciences, Dr. Shweta and Dr. A.K. Sachan, and all the team for starting this good initiative of online certificate course for those who are interested in sleep-related disorders. And so lack of awareness there, and I think this such kind of program will create awareness among the medical fraternity. And we also require the public domain publication through social media and print media and electronic media, so that the masses can also be made aware regarding the snoring and the sleep-related disorder. Even our Prime Minister has the 10% reduction of the oil in the family consumption should be decreased, because he has concern over the increasing obesity. And if obesity is increasing, insomnia and of course obstructive sleep apnea cases will increase. Specialized diagnostic facilities for sleep are few and far. Only 500 over 500 sleep labs are there in India, and their supply is far less compared to the prevalence of sleep-related disorders. For patients to walk in awareness of facilities as a one-stop solution with diagnosis, management, and follow-up their sleep problem, that is also lacking, and this should be made, at least in tertiary care hospital and corporate hospital. So what is sleep apnea? So I really congratulate to the all participant that within certain weeks and months, you will be relatively highly sensitized and skilled trained personnel regarding the sleep-related disorder. And we will be, of course, thankful to you that in the society you will diagnose more and more cases, and of course, our diagnostic efficacy will improve. So sleep apnea is nothing but it's a condition where for a variety of reasons a person ceases to breathe during sleep for 10 seconds, at least 10 seconds or more. There are 3 kinds of sleep apnea. Obstructive sleep apnea because of obstruction in the upper airway. Central sleep apnea because the problem in the central signaling from the central sleep center in the brain. Mixed sleep apnea, that is the combination of 2. So this is the central sleep apnea, which is defined as the absence of both airflow and breathing efforts. Obstructive sleep apnea is having no airflow or a significant decrease in airflow, although they are continuing respiratory efforts, makes this combination of this, if you are not understood by definition, this pictorial will explain you. Obstructive apnea, there is no airflow because of the obstruction in the upper airway. So, however, the rib cage movement and the abdominal movements are going on because the signal from the central of the sleep, that is brain. In central sleep apnea, as there is no signal from the brain, so there is no airflow, there is no rib cage movement, and there is no abdominal movement. So that is the definition between obstructive sleep apnea. This is the difference between obstructive sleep apnea and central apnea. And mixed apnea is the combination of two. Now, this pictorial demonstrates you that normally during sleep, the muscles which control the tongue and soft tissue, soft palate hold the airway open. So whenever you sleep, this is the normal airway movement whenever you are having inspiration or expiration. But what happens when this is the collection of fat around the neck and upper airway, if these muscles, so on these, there's a relaxation of muscles because of the obesity, the airway narrows, causing snoring and breathing difficulty. But still it narrows down. So if these muscles relax too much, the airway can become completely blocked, preventing the breathing, and this is called a stage of apnea. So what is obstructive apnea, sleep apnea syndrome? It's a OSA associated with excessive daytime sleepiness, is known as obstructive sleep apnea or obstructive sleep apnea hypopnea syndrome. Despite being a common disease, OSAS is under-recognized by most primary care physicians. And this innovative idea of training the people through online course is a very wonderful tool of increasing the diagnostic efficacy in medical fraternity and society. An estimated 80% of the patient with OSAS remain undiagnosed. I have, of course, mentioned earlier also. So how you diagnose? And before you diagnose, how you have the state of presumptive OSA. Whenever you go in the society, suppose you are on the railway station, you are on the airport, you are in the train coach, or inside your mela, or like any gathering, social or large gathering, any event, or in even shopping mall, you just observe the patient from even 10 feet, 20 feet, and you can have the diagnosis of presumptive snorer or patient of OSA. So this is basically my common layman slide. In the public domain, I used to say that how you can recognize a snorer or a patient of obstructive sleep apnea. So this is the presumptive diagnosis. The patient is obese, with a short and stout neck. You can see in the pictorial, ideal presentation of all five states. Double chin is there, micrognathia and retrognathia. Everybody knows micrognathia means a small chin. Retrognathia means the retrognathially placed chin. So these are the 5 signs which you can observe from a distance also, 10 feet, 20 feet, even 30 feet. So these 5 signs, everybody should remember and will say from the distance that this is probably a patient of snoring as well as obstructive sleep apnea. But don't dare to say, hey, come here, gentleman, you are having obstructive sleep apnea. Please come to my sleep lab. Don't say like this. But your observation power should be increased, that every time you can observe, whenever you are in the public, that out of the 100 people, 200 people, they are the 2 people who are having probably snoring and obstructive sleep apnea. Now, next step is, after this presumptive, that you just apply this stop bang screening tool for obstructive sleep apnea. There are a lot of tools, but I don't like other ones. I like only this one. Stop bang. Only 8 points you have to observe or ask or measure. And this should be done at your OPD level. First, you observe the patient, and then in the OPD, your nurse or even ward boy or even your attendant will just ask this question before coming to you. So every obese person or any person who is complaining of snoring should be applied with this stop bang score, which means the S stands for snoring, T is for tiredness, O is for observed apneas, P is for high blood pressure, B is for body mass index more than 35 kilogram per meter square, age is more than 50 years, and is neck circumference more than 40 centimeter. Why? 40 centimeter means you can ask the person, आपका जो शर्ट का साइज है वो कौन सा है, 40 है या उससे ज्यादा है. So if it is more than 40, it indicates your state of probably obstructive sleep apnea and snoring. So all those who wear the shirt collar size more than 40, be aware of that you might be having snoring as well as obstructive sleep apnea. Male gender in males are this is more common rather than females. And if the scoring is, you give 1 point to each observation. If the snoring is 0 to 3, it is low risk, but it is 4 plus, it is high risk. So all 4 or 4 plus, they should be subjected for sleep study. So what is the sleep study? In medical language and layman language, it is called sleep study, and in medical language, it is polysomnography. So if you are on paper prescribing polysomnography, please write in brackets sleep study so that patient, attendant, family member, everybody can study and polys. I have seen the prescription. Advise PhD. What do you mean by PhD? Pandit Sri Ganeshan? It is PhD? No, it should not write this. You should write PhD or polysomnography, whatever it is, but in bracket write sleep study so that person and his family member and whosoever see the patient can understand that sleep study has been advised. Gold standard. It's a gold standard test, but requires equipment and trained personnel. Sleep is recorded. Stages of sleep is determined by EZ, OEZ, and EMG, and so many other recording channels. Apnea and hypopnea with oxygen desaturation are noted with body position and sleep stage terminated by arousal. Now, this is the sleep lab photo in our department. This is the normal sleep study, and during the course, you will be taught what are the normal, how to apply hooking and all things, and what are the interpretation of various channels. For example, first is the EOG, ECG, oxygen saturation, airflow, thoracic cage movement, abdominal movement. So many things are there. Sound, snoring sounds, heart rate, pulse rate, everything is there. And position, even right, left, supine, or any other position. So I think this interpretation and this shows the picture of normal sleep study. While this shows, you can see the sometimes flattening, sometimes larger waves. This is the abnormal curves. And then comes the apnea-hypopnea index. What is this apnea-hypopnea index? This is recorded episode number of the apnea and hypopnea episode per hour. And if this is the interpretation, if AHI is less than, the scoring is less than 5, depending upon the so many things, it is called normal. 5 to 15, it is mild sleep apnea. 15 to 30 is a moderate sleep apnea, and more than 30, it is severe sleep apnea. So the assessment of the patient should be done by clinical assessment, laboratory assessment, and polysomnography assessment. Clinical assessment is done by excessive daytime asking the certain question, and excessive daytime sleepiness, fatigue, episodic choking, morning headache, cardiac dysrhythmia, cor pulmonale, so many things. And other comorbid conditions like thyroid, hypothyroidism, diabetes, and hypertension, they should also be asked. Laboratory polycythemia, awake hypercapnia, hypoxia, pulmonary arterial hypertension, and cardiomegaly. And then, of course, polysomnography, that is sleep ready, AHI more than 5, they are diagnostic of. Yes, so that is how you assess the patient. Then management of OSA include the behavioral therapy, lifestyle therapy. This will be taught in detail in subsequent sessions. Modifications, weight loss, positional therapy, avoidance of central nervous system depression, nasal CPAP, which is of course said to be gold standard, mandibular and tongue advancement devices for in certain subset of population, and upper airway surgery, which is usually done by ENT surgeon, can also be tried in certain patients. So this is the probably last slide, and then I will just show you what is our contribution in the field of sleep. So we have 16 publications from our side, and then we have this book that is basically for public domain. This is published by Uttar Pradesh Hindi Sansthan. It is available also there. So I'm not taking any royalty from my any publication, any book. So this was published in 2016, 9 years back. And this is available only at Uttar Pradesh Hindi Sansthan, which is in Hazratganj, just near the metro station or in front of DM residence in Hazratganj. So anybody who is interested in very simple language, of course, before the next section, you can have this book, which is printed and published on the no profit, no loss basis, only costing around 82 rupees. That's all. So you can go through this book so that you can have the general idea of snoring and obstructive sleep apnea. And then we have 2 US patents, and then a lot of awareness articles I request everybody, all consultant, all the faculty in this program, that we should write the various awareness article in the social media, electronic and print media also. And the need of the hour, the last concluding slide, is that dedicated training program in sleep medicine and technology for the spectrum of the healthcare profession should be done. And I'm really thankful to Dr. Shweta and her team and the institute. And of course, it's an honor, Dr. A.K. Sachan, for wonderful initiative for training. Multidisciplinary collaborative sleep center for the diagnosis and management of sleep disorder. And that's why every specialty, almost every specialty, is related directly or indirectly with the sleep disorder, including anatomy, physiology, and biochemistry, which are supposed to be the non-clinical branches, but they're very important part of the sleep-related disorder. Awareness of sleep disorder in the community, that should also be done. Acceptance, awareness, and promoting sleep diagnostic and therapeutics by the authorities and regulatory agencies. Thank you very much. Thank you very much for your attention. Any question, queries, or your comments are welcome. Anshul.
Good morning, sir.
Hi, good morning.
Yeah, so this is Dr. Tazeen from Srinagar.
Okay,
Thank you,
yes,
sir. Thank you so much for the wonderful presentation. Sir, only question I had, like you have mentioned the adolescent and adult sleep for around 8 hours, but there are many patterns where there is a breaking of sleep in between,
yes.
not the complete insomnias.
Okay, yes. So ideally it is should be done 8 hours, but even 4 to 6 hours, that is also good enough for the interpretation. And if person is having so many problems during sleep with the application of the this sleep machine, then we can have even a, this is called like a pulse oximeter. There's a device which is called, I just forget the name. Pankaj, can you name your device? What is that? Pankaj, one,
Yes, sir.
the small device. It's a very important device. Just applied on the fingertip like pulse oximeter. What is that? I just forget. Pankaj.
Sir, one is actigraphy. If you're talking about actigraphy, another
Yeah,
is
yeah. Actigraphy is, but I'm talking of that applied on finger.
which
I
is
also have applied on my fingers. I have used that device. What is that?
one is, I guess, PAT. Somebody's talking about PAT. If it's PAT,
Yeah.
PAT. I'm not sure if you're talking about PAT or something.
Yeah. It's just like a pulse oximeter, and during sleep you have to just apply here only. Or anyway, so I think such kind of other alternatives are available, and we can use them. Yes. Any other question, comments, or suggestions?
I just had a comment. I'm Dr. Indu Khosla. I'm a pediatric pulmonologist.
Great.
Am I
Yes, Dr.
audible?
Indu. Yeah, you are audible.
Yeah. So, just a comment. Thank you for the wonderful lecture. And in such a short time, you have given a complete overview of sleep disorder, sleep apnea. But I just want to highlight that pediatric sleep is very, very
Yes.
different. And we have much more challenges that we face when we do pediatric sleep. Our etiologies are also very, very different.
Yes.
And in fact, the kind of impact that sleep disordered breathing have on children is much higher than what I think an adult can think. Because we have neuromuscular disorders, we have syndromes. There, the morbidity and mortality because of sleep disordered breathing is much higher. And I think as we go through the course, I will try and highlight those aspects.
I think, thank you, Dr. Khosla, for giving wonderful input. Yeah. Thank you, Dr. Khosla, for wonderful input and your suggestions. I think pediatric sleep disorder and pediatric sleep apnea is an entirely different domain. That's why pediatric specialty is different from general medicine. I think, Dr. Shota, do we have the one session on pediatric sleep disorders or pediatric sleep apnea in our module?
Yeah, I have it. That's what I was saying, that I would highlight it when I talk about it.
Sure.
Even our scoring, the ASM scoring, everything is different. So I would highlight it as we take it forward.
So I think, Dr. Khosla, you continue, and Dr. Shota has prepared wonderful program. So I think we have complete package, and you will get one session for the pediatric related sleep disorder also. Any other question or comments? Okay, so thank you very much. Namaste. All the best for all the participants. And I'm really happy, Shota, you have worked very hard. So we are having participant even from Srinagar. So we have trained two persons of Srinagar. One from he was working at GMC Srinagar, and one was in different hospital. So I think we are lucky enough that we have trained the Srinagar people also in our sleep lab. So thank you very much.
Thank you, sir. It's a wonderful session.
As we move on,
I have
we
to
are
go
connected
Sanjay Gandhi
virtually.
PGI for another academic activity. Okay, namaste.
So, though we are connected virtually with
Persons
Sir,
and
our respect, admiration, and
the
gratitude know no boundaries. It is now my honor to request Dr. G.K. Tripathi, Sir, to kindly felicitate Dr. Suryakant, Sir, through this virtual platform. We will request Dr. D.P. Mishra, Sir, to receive the award on behalf of Dr. Suryakant, Sir. We are truly grateful to have Sir's inspiring presence with us today.
स्टेटमेंट करो क्या करें